We're going to start talking about confusion and dementia. Now, we've talked about dementia. We did it in our first couple weeks of school. We watched a video on dementia with dignity. We watched a video on what dementia was, and we're going to talk about it a little bit more. This is a common thing to see in the nursing homes when we're working. So, dementia is that loss of cognitive function, and we're going to talk about when confusion is coming from something else, like acute confusion or a delirium, versus long-term issues with confusion, such as dementia. So when we're, as far as the aging and the nervous system, so when we were talking about the different body systems, and we were talking about what happens when a person gets older, nerve cells are lost as a person gets older. Their nerve conductions tends to slow down, their reactions are slower, vision and hearing decrease, and taste and smell decrease. Blood flow to the brain decreases, and sleep patterns change. We said a lot of times they don't need as much sleep as they used to. Now, forgetfulness, mild forgetfulness, is considered a normal part of aging. Dementia, however, is not. And then sometimes, due to decreased blood flow to the brain, we can see things like dizzy. A person gets dizzy easier. They get a little dizzy when they move too suddenly. So when we refer to cognitive function, cognitive relates to knowledge, and cognitive function is our knowledge of memory, of thinking, of being able to reason with things, ability to understand and to use our judgment and our behavior. That's part of our cognitive function. So when a person has confusion, their cognitive function is going to be impacted. So again, forgetfulness is not considered a loss of cognitive function. It is considered forgetfulness. Okay? Dementia is a loss of cognitive function to the point where it's going to actually keep the person from being able to do their activities of daily living on their own. So the term confusion, it means that the person's not, fully aware of everything that's happening. They're not able to use their cognitive function fully like they should. It can be acute. Okay, it can be acute, or it can be severe or a chronic issue. Now, acute confusion occurs suddenly, and when something occurs suddenly, when you have acute confusion and it occurs suddenly, there is something causing it. There is something life-threatening happening to that patient, and it is not something you want to ignore. You want to make sure you get that person help right away. Severe confusion, especially when it comes on acutely, so acute confusion that is severe, it's called delirium. And so that is usually temporary. Acute confusion that is severe comes on suddenly. There's something causing it. Lack of oxygen to the brain, lack of circulation, lack of blood flow up to the brain. There's something major event that's happening to that person to cause this sudden severe confusion going on. And so we have to address it, and if we do and we can fix the cause of it, there's a good chance that this confusion is just going to be temporary. It's not going to be a permanent thing. Now, some things that can cause that acute confusion: a severe infection. So when a person gets infected, we've talked in previous classes how it can get into the bloodstream and get carried throughout the body, and the person can have sepsis. They can become septic, and sepsis can cause confusion. So a severe infection, a severe illness, injury where they're not getting enough blood and oxygen potentially up to the brain. We've talked about respiratory issues. We've talked about with oxygen therapy. We talked about that term hypoxia, where the person's not getting enough oxygenation to the tissues. You're not getting enough oxygenation up to the brain, they're going to be confused. Okay? Medications, because all medications have side effects. All medications have side effects. And think about all the medications that we've seen our residents over in the nursing home that we've been taking care of get. Some of these residents get 20 meds, okay? And every medication has a side effect, and those side effects can potentiate the more medications they take. A person having surgery after anesthesia, maybe they're confused because of the anesthesia, but maybe it's more than that. Maybe they're confused because they're not oxygenating well. So confusion so when a person's having that sudden severe confusion known as delirium, We want to look for the cause of it and treat the cause as soon as we can. And if we can treat the cause and take care of it, a lot of times it will be fixed. Confusion caused by physical changes, permanent physical changes, that we can't always, that isn't going to be able to be cured. So when we're caring for someone who gets confused suddenly, so we're not talking long-term dementia issues, we're talking about that person has that sudden onset of severe confusion. We need to think about safety. We want to provide safety for the person. Face the person. Speak clearly for them. And remember, when a person is confused, they're not going to be processing information correctly. Now, when we talked about how the body changes with aging, we said people tend to process a little bit slower. Reactions are slower. So we said when you're asking questions, you need to slow down a little bit. You need to give them time to think about it and process it before you can expect an answer. Well, if they have confusion, that's even more pronounced. Call them by name every time and say your name every time. They're not going to remember from 5 or 10 minutes ago if they have delirium going on. Reorient them frequently, so we tell them frequently where they're at and what's going on with them. Now, one thing that when we talk about the dementia patient, though, I will clarify here, reorientation is fine. When a person says, where am I, or what's happening, I will tell them where they're at and what's happening. But when you have a patient with dementia, where you have a permanent confusion state, telling them, when they say, oh, I need to go home, I have to go home, I have to go home to my mom, and it's like, well, their mom's dead, and their home's already sold, and this is where they live, to tell them that, they are going to have a catastrophic reaction to that. But when you have someone with acute confusion, we do try to reorient them frequently. We explain what we're doing all the time, and keeping calendars and clocks in easy-to-see areas is helpful, and being consistent and following normal routines is helpful when we're caring for a confused person. So we're going to see in the nursing homes, they tend to have these, they tend to have calendars posted in the patient's room, and then there's usually a really large one in a big hallway. And it'll say the date, if there's any events coming up that the person wants to do. They have activity calendars that'll have the activities listed for them, but they're usually nice and big so the person can see them. Now, when we're talking about dementia, this is different. So dementia is the loss of cognitive function that interferes with routine, personal, social, and occupational activities. And this, unfortunately, there's no cure. It is not considered a normal part of aging. It's a group of symptoms that occurs with certain diseases or conditions. So we have to keep that in mind. Mild forgetfulness, dementia, never normal. This is a disease process. So some early warning signs of dementia: recent memory loss that affects job skills. So I'm not just talking, you forgot where you put your keys. I'm talking about you forget how to work the computer, you forget how to turn it on, you forget how to do basic things that you've done many, many times. So problems with those common tasks. Problems with language, forgetting simple words, getting lost in familiar places, misplacing things or putting things in odd places, personality changes, poor or decreased judgment, or loss of interest in life. Those are warning signs that maybe it's more than just a mild confusion or an acute problem, that maybe we actually have loss of cognitive function here. So when a person is first showing exhibits of confusion, we need to check. When they need to go into the hospital, they need to get checked out and make sure that there's nothing acute going on that we can fix and take care of. If there's nothing acute going on that we can fix and take care of, then we're going to start working them up to see if maybe it is a dementia issue. So, sometimes when people even look in the mirror, they don't even remember their own face anymore. Generally what happens with dementia is people lose their short-term memories first, and they kind of tend to remember things from the past, things from when they were growing up. So they may not remember themselves as an older person, and so they may not even recognize themselves anymore in that mirror. So with Alzheimer's disease, AD, it's the most common type of dementia. Dementia is a big umbrella term. So dementia is a big umbrella term for loss of cognitive function. And then there's different types of dementias. And the most common type is Alzheimer's disease. Nerve cells that control intellectual and social function are damaged. And so this is going to impact memory, it's going to impact thinking, reasoning, judgment, language, behavior, mood, and personality. All of those can be impacted with AD. I thought this was cute. It says, after many years of therapy, Waldo finally finds himself. My kids always like those Finding Waldo books. I thought it was pretty funny. But with Alzheimer's, the risk increases with age. And so, for some people, they have early onset of dementias where it will start at a much younger age. But usually it increases, the chance of it increases when you're 65 and older. And with each decade you get, your chance of getting it increases even more. The exact cause of it is unknown. It's been shown when they do autopsies on the brains of people that have dementia. They have found that there's lots of tangles and twisted protein fibers that build up in the brain. So they have all of these, so in the neurons themselves, they have these tangles happening, so the synapses aren't passing information on clearly. And then these what we call amyloid plaques, these protein pieces that are in between that build up in the spaces of the nerve cells, and then again keep the synapses from being able to pass information from one neuron to the next. I thought this was interesting. It says, senile dementia is not so bad, Mrs. DuPont. It's kind of like having brand new friends every day, but it really isn't. It's terrifying for people to wake up and not know where they're at, not remember what's happened, what's been going on with them. That's not something that's ever going to be comfortable. They don't wake up and think, oh yay, I get to meet all new people. They're terrified because they don't recognize anybody, even though you may have been taking care of them for years. Now, the more stability that you give them, the more routine that we follow for these people, the more that we keep the same people working with them, the better it's going to be for them. But it is something that, because routines are exceptionally helpful for patients with dementia. So signs and symptoms of Alzheimer's disease: gradual loss of short-term memory, asking the same questions over and over, repeating the same stories over and over, forgetting how to do normal activities, forgetting how to use the hairbrush, forgetting how to use the bathroom, getting lost in familiar places, neglecting hygiene. And I'm not sure why that happens, but it's a very common thing to see with dementia patients, is they don't want to get cleaned up anymore. Even people that always got cleaned and dressed every day and wore their makeup all the time and never went out of the house without lipstick on, always color coordinated, they just quit taking care of themselves and they quit doing hygiene. And a lot of times they're unable to answer questions. And one thing I'm going to tell you with the patient with Alzheimer's disease is don't bombard them with a lot of questions. One question at a time. Give them time to process it, see if you can get a response. And if they're not really speaking to you, sometimes a picture. Sometimes they do much better with pictures. So instead of saying, it's time to give you a bath and get you dressed, you can just show them a picture of someone getting cleaned up. And that sometimes they can connect with a little bit easier. So sometimes that's a helpful tip. So behavior problems that we see with Alzheimer's disease: some of the residents will get worried and angry. Wandering is very common with this type of dementia. And it happens so often. There is we call it a elopement. It's a code green, or a patient elopement, where the patient sneaks out of the facility. They're frequently wandering out of the facility. So a lot of times these residents will have these tab alarms on, or alarms that will screech if they try to go out the doors. So it's something that to keep in mind when you're hearing those screeching alarms. Please don't ignore it, even if it's not your patient. Go see what's going on, because sometimes these residents will start wandering out in the street. They don't know where they're at, and they can get hurt. Sundowning is very common with AD as well, and that's where the signs and symptoms and behaviors increase during the hours of darkness. So during the day, they seem to function pretty well. They're friendly, they're cooperative, and as the evening goes on, they start becoming agitated, aggressive, and their symptoms seem to manifest even more. And they don't really know if it's just because they're so tired by the end of the day, but it's, that's a pretty typical thing to see with Alzheimer's disease. Hallucinations are seeing, hearing, smelling, or feeling something that's not real. Delusions or false beliefs. catastrophic reactions are extreme responses. So you're going in there to clean them up, and they just start screaming and screaming and screaming, and all you did was try to take them in to get them cleaned up. Agitation, restlessness, and some of the residents are going to get aggressive or combative with it. They may show signs of depression or abnormal sexual behavior. Now, one thing about abnormal sexual behavior, if you have a resident that's doing abnormal sexual behavior, let's say they're touching themselves inappropriately, and let's say they're in the activities room, please take them back to the room, okay? And you can pull the curtain and just give them some privacy at that point, versus fighting them to make them stop doing that. But the other thing to keep in mind is sometimes it looks like an abnormal sexual behavior, but they're rubbing themselves or picking at themselves because they have an infection going on, or they haven't been cleaned properly. So keep that in mind as well. We need to make sure hygiene is really good for these people. Repetitive behaviors are really common as well, but they're just going to repeat themselves over and over. So Alzheimer's has no cure, so comfort and safety are going to be important for these people, making sure we try to prevent skin breakdown and contractures, treating these people with dignity and respect. Okay. Range of motion is important. The person may need hospice care as death nears because there isn't a cure for this, so this is going to end in death. Neglecting hygiene is a really common thing, as I mentioned, so infection is always a potential issue with these patients. Now, do we do care for these people? So if the person's refusing care, can we still give care? And the answer is actually yes. A person has the right to refuse care if they have cognitive function, if they understand what that risk means. That, hey, you don't let us care for you properly, you're going to get an infection, you're going to get pressure ulcers, you're going to get this, you're going to get that. And if they understand that and they're still refusing, they have that right. But when a person has dementia and they don't understand, they can't understand what's going to happen to them if they're refusing it, then it's usually their caregiver that's responsible for their care that decides whether things are still going to be done for them or not. And I can pretty much tell you they're going to want the care done for them. Now, if your patient, when you're trying to give care, if they are getting agitated and they are getting aggressive, some things that will help is giving care in smaller increments. So, for instance, when we do vital signs, maybe I get their temperature, and they're starting to get agitated, so I'm going to leave them and just let them be for a little bit, and then maybe 15 minutes later I can come back and I can get pulse and respirations, and then maybe I can come back later and get blood pressure. Sometimes doing care in small little increments is beneficial for these people. It will let them tolerate the care a little bit better. It doesn't overly stimulate them where they have those aggressive tendencies from it. Now, with that being said, some people, it doesn't matter if you do it in small increments or you just chunk it out and just get it all done at once. They're still going to have those catastrophic reactions. So sometimes it might be better just to go ahead and give the care. Part of that's going to be learning your resident, okay? Learning what's best and what works well for them. So home health care can help for a while. A lot of people that have a loved one that has dementia, they want to take care of their residents or their family at home, so they try to keep them at home, and they might have a home health agency come and help them. It may get to a point where they just don't feel they can take care of their loved ones safely anymore. The person keeps wandering out. The person keeps having aggressive behaviors when they're trying to care for them, and they don't know how to cope with it. They don't know how to deal with it, and so they determine to put them in a long-term care facility. It's heartbreaking for these family members, and a lot of times they feel so guilty because they couldn't take care of them properly, and we should never make them feel that way. So long-term care is needed when the family members cannot meet their needs anymore, or when the person no longer knows the caregiver, or maybe the family member is having health issues now, or there's money problems. So if their behavior is presenting a danger to themselves and to others, it may be time to actually go into a nursing home setting. Now, one of the ways we've been mentioning that one of the best things you can do when caring for a patient with dementia is do care in small increments. Try not to rush them. We watched that video where we did a hand under hand technique, where you just put your hand out, turning your hand out where palm up. It seems less threatening. So holding your hand out to them and hoping that they'll take yours, a lot of times that will be better tolerated, and you can guide them to doing the things that you need them to do. What validation therapy is it's if it's used by your facility, you don't try to correct everything that a person says. So so that instance I gave you where the person's saying that they want to go home, that they need to see their mother, and they're 90, mom's been dead for 15 years, their home's been sold, to say, oh, don't you remember your mom died 15 years ago, you don't have a home to go back to, this is where you live now. They are going to literally go through a grieving process. They're going to go through a grieving process, and yet 10 minutes later, they're not going to remember it. And so then you correct them again an hour later, we're going to go through it again. That's just cruel. So I don't lie to my patients. I don't believe in that. I don't lie to them. I'm not going to say, oh yeah, your mom's going to be coming later today. I don't lie to them. But what validation therapy is we try to just change their train of thought. Like, you know what? Mothers are amazing. They're amazing. What did you and your mom like to do together? What did you and your mom like to do together? Just try to get them to remember happy thoughts and good times that they had. And it just kind of changes their train of thought when they're starting to get agitated. So routines are important. Validation therapy helps a lot. Doing care in small increments has been shown to be very helpful. And if your patient is getting aggressive, you need to just stop and walk away. And one thing that they have found that helps, though I don't know how practical this is going to be, but in units, now remember in regular nursing homes, they cannot keep the doors locked. They can put tab alarms if the person's wandering. But if you work for a dementia care center, and that's all they take care of is dementia patients, they do have locked doors. We have to have a key to get in and get out. One thing that they recommend when you're working in a dementia care center is keep an extra uniform top available, because they have found that if patients are starting to get really agitated, really aggressive, you just leave, you wait 15 minutes, you change your top into a different colored top, you come in, and sometimes they're just fine with you. They're just absolutely fine with you. So sometimes that's helpful as well. The other thing they like to do for these patients is they like to keep the same staff assigned to them for that routine. So there is some familiarity there. Now, obviously, when the person goes off duty and has a few days off or on vacation, that's not always going to be done. But generally, you're going to see in the nursing homes that the CNAs are assigned to the same group of patients on a routine basis, because you know your resident. You know what they like to do, what they tolerate, what they don't tolerate, how much care you can give them at one time, how they like things done. And when you know a person's routine, the patient's usually happier and they tolerate the care better, and it's usually more, it streamlines your care because you know what to expect and what to do. So it's kind of a win-win situation. So here is a scenario. Well, this one I already gave you about the mother dying, but let's try this one. So Dr. Carroll is a retired doctor with Alzheimer's disease. He wants to go to the hospital to make rounds on his patient. The CNA reminds him he's retired, and he gets agitated. What is another way to approach that situation? So the reason I put this one as an example is I was working at a nursing home, and we did have a retired physician, and every morning he wanted to get up and get dressed so he could make his rounds. He wanted to go and make his rounds. So we used to get him up, get him dressed, and we would take him into the activities room. And he was so adorable, and he would go up to all the residents sitting in the activity room, and he would just go up and he would take their hand and he'd say, how are you today? Is there anything we can do for you today? Are you feeling okay? And if they were feeling okay, then he would go to the next patient. And you know what? The patients he touched and checked in with, they felt good, okay? And he felt good. And it didn't harm anything. So, it's just something to keep in mind. Sometimes we don't have to lie to the person. But we can make them be able to adjust to their truth, okay, so they don't get quite so agitated. So are there things you can do to prevent dementia? So I went to a class on how to prevent dementia one time, and I found it very interesting. Some of the studies he talked about, when I looked up the studies and some of the research, some of it was well proven, some of it was, they showed it with one study, but they couldn't re-show it again. So, but I really found it a very interesting talk. And one of the things that they really recommend is learning new things every day. So 15 minutes a day can improve your cognitive ability. So whether it's with music, with language, with crossword puzzles, with Sudoku, reading new things, reading new genre of books, just 15 minutes a day of something new and different can improve your cognitive function. Keeping socially active. Very well proven that people that are socially active go through the aging process better and retain their cognitive function longer. So staying socially active with people. Keep a positive attitude as much as you can. The more positive you are, they have found that the less negativity that you have, and I don't know if it's because of hormones that are secreting during that time, but they have found that people that have upbeat and more positive attitudes and stay socially active tend to have less dementia. Eating healthy, green leafy vegetables, antioxidants, omega-3 fatty acids like from fish, nuts, and seeds, B vitamins, multivitamin, avoiding sugar spikes, not having like 10 cookies and then letting your sugar level drop, and then having a donut and letting your sugar level drop, keeping just moderate amounts of sugar and not having the high spikes in the sugars. Avoiding artificial sweeteners, your NutraSweet, your Sweet and Lows, avoiding MSG, avoiding aluminum, cooking in aluminum, storing foods in aluminum, this one study was showing. Decreasing stress has been shown to be beneficial over the long term of your lifespan. Regular exercise and exercising, like active exercise for about an hour a day. They have found that people who do that tend to have less dementia. And then regular dental checkups. They actually did a study of people that do, and they did this with twins, which I found was a really interesting study. So it wasn't a huge study, but they did it with twins, where one was doing regular dental checkups, regular dental cleaning, regular dental checkups, and one was not. And they found that the one who was doing regular dental care, there was less periodontal disease, and they found that there was less Alzheimer's showing up later in life. So again, kind of limited study, but interesting. So we need to eat healthy, live a healthy life, exercise regularly, stay socially active, keep learning new things, and that hopefully will help us stay younger in our mind for a little bit longer, possibly, than we can. Now, there is a genetic component to dementia, and there is testing that you can have done. So you can get genetically tested to see if you have the gene that would potentially have a tendency possibly to become dementia. But there's a lot of pros and cons with that. Some people feel like, okay, you should get this tested, because if you do have that tendency to turn, to get Alzheimer's as you get older, or to have dementia as you get older, you can be more aggressive about learning new things, staying socially active, being really proactive in this. And if your family members start noticing memory issues, maybe you can start getting treatments. There are medications that can slow the process down. No cure for it, but medications that can slow the forgetfulness down. So you could get started on those a little bit earlier and possibly slow the process of this down a little bit. Or there's the thought of, are you going to find out that you have this gene and be completely depressed by it, be sure that you're going to have it, and kind of give up doing all of these things? So, I think you know yourself best as to whether that would be anything that would interest you, and what your family history is of having dementia. But those are just some things to keep in mind. So we will continue to be looking at dementia as we go through this class, because as I mentioned, in the nursing home, we are going to be taking care of multiple residents that have dementia issues, and learning how to talk with them, and learning how to still treat them with respect and dignity, still try to give them choices whenever possible, trying to keep them from having as many catastrophic or agitated episodes. Very, very important, okay? And sticking to their routines and using that validation therapy can help tremendously. So we will stop at this point.